Welcome back to Community Conversations. I'm your host, Steve Mantis, and my guest today is Doug Moynihan, the CEO of the Atikokan General Hospital. So Doug, we were just talking about health, and what is health? I mean, our hospitals, we think of kind of as the centerpiece of our healthcare system, but what's that system all about? How do we define health? What are we talking about here?
Well, it's an interesting question, because the answer really is in the mind of the beholder. I mean, as I mentioned earlier, I spent a lot of time in the private sector, where when you measure quality or service, it's pretty straightforward. It's what the customer wants. In healthcare, it's an interesting situation. You may be my doctor, and I may come in to see you thinking that I am very, very sick. And you listen to me, and at the end of the meeting you may say, Doug, I think you're okay. So I can perceive that I'm not well, and the professional can say no, but the opposite can appear. I can come in feeling brash and feeling like I'm quite healthy, and you take some tests and you say, Doug, I've got some bad news for you. So that relationship between the provider and the patient, in terms of quality, is a very dynamic relationship, and the conversation about what is quality care is huge. And so, for example, you see in the headlines quite a bit the wait times for the emergency department, on average in Canada are 4.4 hours. Isn't that terrible? Well, it depends, because we don't determine who comes into the emergency department. It could be somebody like me in my first instance, where I'm really not that sick, and I could complain that I've been sitting in that emergency department for 5 or 6 hours. The doctors have examined me and they've triaged me. Those are few examples. Those are, not a lot of the situation is like that, but the concept of health is really in the mind of the beholder, and until you're sick, I think there's a Dutch proverb that says that disease comes on a horseback and leaves by foot. So many of us are healthy for most of our life, and then suddenly when we get sick, it's a pretty serious situation.
And it is sudden. All of a sudden, we're fine, and then the next day,
absolutely,
or so it appears to us.
Yeah.
But how does that fit with what you were talking about earlier, that we drink more, we smoke more, our health, we're a bit overweight more than other folks in the province? How do they relate together?
So the reality is that people think of healthcare, they mostly just think about the hospital, where in fact the hospital is really the last place where we want people to go. I should be trying to put myself out of business if I can. The way to avoid people coming into the hospital is through preventative health and through home care. And that's a strategic plan that is not only happening here in Arlin in Thunder Bay, but right straight throughout the land. Prime Minister Trudeau, he has a huge amount of tax money that they give in their healthcare funding each year to the provinces. And this year he said, I want you to focus it in on mental health and on home care. Mental health is a huge issue in our country and in Ontario for sure.
So this is the new dollars that the federal government, we've been hearing how they're negotiating with each province about these increases. The new dollars are for mental health and home care.
Yeah. So what we're trying to do, to come back to the population health issues here in this area, is to focus more on education. So I don't know, your listeners probably know Howie Mandel. He has been a real proponent of educating people on healthcare, and particularly mental health. And he thinks that in every public school, as just part of the curriculum, we should be talking about relationships and emotions and mental health. And it starts right with our kids, to help people so that they can deal with, if you continue to smoke, if you don't exercise, if you don't eat your fruits and vegetables, you are going to get sick sooner than the next person. There's a quote here, if you don't mind, in terms of health. Mickey Mantle once said, if I knew I was going to live this long, I'd taken much better care of myself.
Well, and that, that reflects, from us from 50 years ago when we were looking to the future. And you don't have the perspective of a senior citizen when you're 20-something years old.
Absolutely, you don't. I was listening to CBC the other day. They were celebrating our 150th anniversary as a country. And one of the interviewers said, yes, and soon people will be living that long. And one of the other professionals said, yes, and not only that, but probably the first person who's going to live to be 150 is already born. So it could be your grandchild or my grandchild that is already born that's going to live to be 150.
See, here 50 years later, you're still blowing my mind. Oh my God.
So we want to focus on the preventative health, and we want to focus on home care. And because if people end up in the hospital, it's not the best place to be, and it's very expensive. Mental health care in Ontario takes almost half of our whole provincial budget. So $50 billion, almost $50 billion. And it's going to get bigger because people like you and I, the baby boomers, it's inevitable as we get into our later years in life. The healthcare costs for people like you and I are really steep in those last year or two of our lives, which we usually spend in a home or in a hospital, which is exceptionally expensive. So we want to avoid that, keep people healthy before they end up in the hospital.
And so how does that affect your role as the CEO of Atikokan General Hospital and the work that the staff do in the hospital?
Good, it's a good question. So every day we have to deal with what's presented to us. The people that come into the emergency department, we have people that are, given some treatment and sent home versus people that are more seriously ill and admitted. So we have got standards of care, and so if you are admitted with pneumonia, then there's certain procedures that we have to comply with to make sure that we get you as healthy as possible, as quickly as possible, and get you back out of the hospital. So that's in our acute side of the hospital. That's our main focus. Mm-hmm. We get a huge amount of support from the Thunder Bay Regional and from the ministry. So, for example, we provide chemotherapy for people with cancer in Atikokan, and that's managed by the Cancer Care Ontario. So there's organizations within the province that are specialists. And so if we have, for example, an automobile accident, which would be terrible, but sometimes it happens on the highway by Atikokan. So we don't have a lot of specialists in our emergency department, but we can hook up via video. So we connect up directly with what they call intensivist surgeons here in Thunder Bay, and it's just like they're right in the emergency department trauma room. So our world is really working with trying to find the best available advice and treatment and diagnosis and treatment from wherever we have to go to get it, and then deliver that in Atikokan.
Doug, we need to take a short break, but when we come back, we're going to talk a little bit more about how the healthcare affects you in our listening audience. Stay with us. We'll be right back.